Hi everyone, welcome to Be Different for Success. Today we'll be talking about binge eating disorder. Binge eating disorder, BED, is a type of feeding and eating disorder that's now recognized as an official diagnosis. It affects almost 2% of people worldwide and can cause additional health issues linked to diet, such as high cholesterol and diabetes. Feeding and eating disorders are not about food alone, which is why they're recognized as psychiatric disorders. People typically develop them as a way of dealing with a deeper issue or another psychological condition such as anxiety or depression. This video looks at the symptoms, causes, and health risks of BED, as well as how to get help and support to overcome it. What is binge eating disorder and what are the symptoms? People with BED may eat a lot of food in a short amount of time, even if they aren't hungry. Emotional stress or distress often plays a role and might trigger a period of binge eating. A person might feel a sense of relief during a binge, but experience feelings of shame or loss of control afterwards. For a healthcare professional to diagnose BED, 3 or more of the following symptoms must be present: eating much more rapidly than normal, eating until uncomfortably full, eating large amounts without feeling hungry, eating alone due to feelings of embarrassment and shame, feelings of guilt or disgust with oneself. People with BED often experience feelings of extreme unhappiness and distress about their overeating, body shape, and weight. What causes binge eating disorder? The causes of BED are not well understood, but likely due to a variety of risk factors, including genetics. People with BED may have increased sensitivity to dopamine, a chemical in the brain that's responsible for feelings of reward and pleasure. There is also strong evidence that the disorder is inherited. Gender. BED is more common in women than in men. In the United States, 3.6% of women experience BED at some point in their lives, compared with 2% of men. This may be due to underlying biological factors. Changes in the brain. There are indications that people with BED may have changes in brain structure that result in a heightened response to food and less self-control. Body size. Almost 50% of people with BED are obese, and 25 to 50% of patients seeking weight loss surgery meet the criteria for BED. Weight problems may be both a cause and a result of the disorder. Body image. People with BED often have a very negative body image. Body dissatisfaction, dieting, and overeating contribute to the development of the disorder. Binge eating. Those affected often report a history of binge eating as the first symptom of the disorder. This includes binge eating during childhood and the teenage years. Emotional trauma. Stressful life events such as abuse, death, separation from a family member, or a car accident are risk factors. Childhood bullying due to weight may also contribute. Other psychological conditions. Almost 80% of people with BED have at least one other psychological disorder such as phobias, depression, post-traumatic stress disorder, bipolar disorder, anxiety, or substance abuse. How is BED diagnosed? While some people may occasionally overeat, such as at Thanksgiving or at a party, it does not mean they have BED, despite having experienced some of the symptoms listed above. BED typically starts in the late teens to early 20s, although it can occur at any age. People generally need support to help overcome BED and develop a healthy relationship with food. If left untreated, BED can last for many years. To be diagnosed, a person must have at least one binge eating episode per week for a minimum of 3 months. The severity ranges from mild, which is characterized by 1 to 3 binge eating episodes per week, to extreme, which is characterized by 14 or more episodes per week. What are the health risks? BED is associated with several significant physical, emotional, and social health risks. Up to 50% of people with BED are obese. However, the disorder is also an independent risk factor for gaining weight and developing obesity. This is due to the increased calorie intake during binging episodes. On its own, obesity increases the risk of heart disease, stroke, type 2 diabetes, and cancer. Other health risks associated with BED include sleep problems, chronic pain conditions, asthma, and irritable bowel syndrome. Research has shown that people with BED report more challenges with social interactions when compared with people without the condition. Additionally, people with BED have a high rate of hospitalization, outpatient care, and emergency department visits, compared with those who don't have a feeding or eating disorder. Although these health risks are significant, there are a number of effective treatments for BED. What are the treatment options? The treatment plan for BED depends on the causes and severity of the eating disorder, as well as individual goals. Therapy options include cognitive behavioral therapy, interpersonal psychotherapy, dialectical behavior therapy, weight loss therapy, and medication. These may be carried out on a one-to-one basis in a group setting or in a self-help format. In some people, just one type of therapy may be required, while others may need to try different combinations until they find the right fit. A medical or mental health professional can provide advice on selecting an individual treatment plan. Cognitive behavioral therapy. Cognitive behavioral therapy for BED focuses on analyzing the relationships between negative thoughts, feelings, and behaviors related to eating, body shape, and weight. Once the causes of negative emotions and patterns have been identified, strategies can be developed to help people change them. Specific interventions include setting goals, self-monitoring, achieving regular meal patterns, changing negative thoughts about self and weight, and encouraging healthy weight control habits. Cognitive behavioral therapy has been demonstrated to be the most effective treatment for people with BED. Interpersonal psychotherapy. Interpersonal psychotherapy is based on the idea that binge eating is a coping mechanism for unresolved personal problems such as grief, relationship conflicts, significant life changes, or underlying social problems. The goal is to identify the specific problem linked to the negative eating behavior, acknowledge it, and then make constructive changes over 12 to 16 weeks. Therapy may either be in a group format or on a one-to-one basis with a trained therapist. It may be particularly effective for people with more severe forms of binge eating and those with lower self-esteem. Dialectical behavior therapy. Dialectical behavior therapy views binge eating as an emotional reaction to negative experiences that the person has no other way of coping with. It teaches people to regulate their emotional responses so that they can cope with negative situations in daily life without binging. The 4 key areas of treatment in DBT are mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Weight loss therapy. Behavioral weight loss therapy aims to help people lose weight, which may reduce binge eating behavior by improving self-esteem and body image. The intent is to make gradual, healthy lifestyle changes in regards to diet and exercise, as well as monitor food intake and thoughts about food throughout the day. How to overcome binging. The first step in overcoming binge eating is speaking to a medical professional. This person can help with the diagnosis, determine the severity of the disorder, and recommend the most appropriate treatment. In general, the most effective treatment is cognitive behavioral therapy, but a range of treatments exists. Depending on individual circumstances, just one therapy or combination may work best. No matter which treatment strategy is used, it is important to also make healthy lifestyle and diet choices when possible. Here are some additional helpful strategies. Keep a food and mood diary. Identifying personal triggers is an important step in learning how to control binge impulses. Practice mindfulness. This can help increase awareness of binging triggers, while helping increase self-control and maintaining self-acceptance. Find someone to talk to. It is important to have support, whether it is through a partner, family, a friend, binge eating support groups, or online. Choose healthy foods. A diet consisting of foods high in protein and healthy fats, regular meals, and whole foods will help satisfy hunger and provide needed nutrients. Start exercising. Exercise can help enhance weight loss, improve body image, reduce anxiety symptoms, and boost mood. Get enough sleep. Lack of sleep is associated with higher calorie intake and irregular eating patterns. It is recommended to get at least 7 to 8 hours of good sleep per night. The bottom line: BED is a common feeding and eating disorder that, if not treated, can seriously affect a person's health. It's characterized by repeating, uncontrolled episodes of eating large amounts of food and often accompanied by feelings of shame and guilt. It can have negative effects on overall health, body weight, self-esteem, and mental health. Fortunately, very effective treatments are available for BED, and there are also many health lifestyle strategies that can be incorporated into everyday life. The first step in overcoming BED is to ask for help from a medical professional. Thanks for watching this video. I hope you liked it. Please click the thumbs up and write your personal tips in the comments below. Thank you for your support, and don't forget to subscribe to the channel if you want to hear more from us. See you in the next video.